So there's a number of studies looking at the quality of life, and a way of measuring anxiety and depression is Beck's depression score and a quality of life survey called QF36. There's probably over 100 studies looking at that, following different types of bariatric surgery, and in all cases the quality of life is dramatically improved and the levels of depression and anxiety are dramatically reduced. Again, it's not the surgery that is causing those, it's the surgery producing the weight loss that leads to the improvement in quality of life and mood. With medications, they're relatively new, so we don't have as many studies on quality of life and the effects on depression and anxiety, but there is no doubt if it produces the same types of weight loss, studies in the future will show that medication has the same effect. So with the point of quality of life and anxiety, depression, it is the weight loss that's causing that. Patients also come for a whole heap of different reasons. Some patients, they've lost their job. So we have lots of FIFOs in WA. You need to be under 140 kilograms to fit in the cab to drive the truck. And a lot of the patients are males who have failed a medical at work and told they have to lose weight, otherwise they're going to lose their job. So keeping their employment is one reason for patients. And obviously those patients lose weight and keep their job, makes them happy. The other ones are patients who have got comorbidities that are newly diagnosed. So a common indication would be a patient has been seeing their GP for a long time and all of a sudden their blood pressure shows diabetes, or the blood pressure is really high, or they have a routine blood test for a medical and their cholesterol is through the roof. Those patients, again, they're newly diagnosed, they're worried about their health, and so they're having the weight loss surgery, not specifically to help them psychologically, but to help their comorbidities, which once they get rid of those comorbidities, again is going to improve their quality of life and their psychological well-being. Another group of patients that we see quite a lot of is patients who have poor mobility. So their weight has got to such a tremendous level, 180, 200 kilograms, that they're finding mobility issues is really difficult. They can't fit into their car, they can't get outside, they can't tie their shoelaces. And those patients' psychological well-being is obviously very poor because a lot of them are housebound. So again, those patients that we call high BMI, or we sometimes call them super obese patients with a BMI greater than 50, those patients have real mobility issues and their psychological well-being and quality of life is poor as a result of that. Those are another group of patients that psychologically do really well following the weight loss surgery. And then the final group of patients are young females with primary infertility. So they have polycystic ovarian syndrome, which makes it very difficult for them to get pregnant. And in the past, a lot of those patients had IVF, but now Medicare and the health funds restrict IVF to patients whose BMI is lower than 30 because they know the success of your BMI is greater than 35 is not great. So a lot of those patients who come to us when they're young are really for infertility, and we've got a number of patients at Wheelers who have undergone weight loss surgery and then fell pregnant naturally once their BMI was below 30, and that obviously has a great psychological effect on those patients. So each patient that comes to weight loss is pretty unique. They have a unique set of circumstances, they have a unique ambition, they have a unique aim that may be getting their employment back on track, it may be having a baby, it may be curing their diabetes, or it might even be that the patients have come because their mum or their dad has developed an illness. You know, their mum's got cancer of the breast, or the dad's got cancer of the stomach, or the mum or the dad's got diabetes, and they see themselves slipping into the same lifestyle their mum and dad had, and they don't want to get those illnesses. So a lot of the time, it's a parent who's getting diagnosed with a cancer or an illness that causes the patient to come to weight loss to lose weight. Breast cancer in particular is one that's very common amongst females, And with breast cancer, there's 3 things that's not so good for breast cancer. Being female, having a strong family history, and being overweight. The first 2, there is nothing we can do about. You have to keep your femaleness, and you can't change your mum if you've got a family history of breast cancer. Being overweight or obese is the 3rd factor you can change for that. And quite a lot of the patients, as I say, they've got a family history or their parents just been diagnosed, and it's made them take action to prevent them falling down the same path.